Welcome to Swati.E.Learning channel. In Pediatrics, today we will see about the fetal circulation. Fetal circulation system is distinctly different from adult circulation. The fetus receives oxygen and nutrients from the placenta for development. Normal fetal heart rate between 110 to 160 beat per minute. Fetus must have blood flow to placenta. Introduction. By the third month of development, all major blood vessels are present and functions. There are several temporary structures in addition to the placenta and umbilical cord that enable the fetal circulation. Definition. The circulation of blood from placenta to throw the fetus back to the placenta known as fetal circulation, or second definition is fetal circulation is circulation of oxygenated blood, deoxygenated blood, nutritive material etc. in the fetus from the mother. Functions are: it provides the fetus with nutrient oxygen while removing waste product and carbon dioxide from the fetal circulation. Indirectly, it means it gives the nutrients and it works as a respiratory system. Temporary structure. One umbilical vein is present in the vein will carry oxygenated blood and nutrients from the placenta to the fetal body. There are two umbilical arteries, one vein and two arteries, branches of the iliac arteries returning deoxygenated blood from the fetal back to the placenta. Ductus venosus, meaning a ductus from the vein to the another vein. It is a continuation of umbilical vein convey 85% oxygenated blood as it passes into the fetal abdomen, and it gives branches to the liver. After bypass the liver, it joins to the inferior vena cava, that is called ductus venosus. This causing mixing of oxygenated blood from the placenta with the deoxygenated from the lower half of the fetal body. So here you can see the diagram of the fetal circulation. So the first upper you can see ductus venosus. Then you can see there is a below side there is a where in the liver there is a ductus venosus, and arteriosus is the aorta and pulmonary artery joining ductus arteriosus. Then foramen ovale between the atrium septal there is a foramen or ovale. These are the three basic changes that will be taking place during after the first breath out. Here you can see there is a one vein and two umbilical artery at the lower side. Temporary structure foramen ovale meaning oval opening. It is the opening between the septum between the right atrium and the left atrium of the fetal heart. The foramen ovale is constructed with a valve or flap on the left side of the septum. Foramen ovale, you can see there is a patent foramen ovale. That is the right atrium and the left atrium, there will be a mixing of a oxygenated and deoxygenated blood. Ductus arteriosus, that artery to the another artery. It is a duct which leads from the junction of the pulmonary artery to the descending aorta. As the lungs are not functioning, most of the blood is diverted via the ductus arteriosus into the descending arch of aorta. So ductus arteriosus, you can see there is opening between the aorta and the pulmonary artery, that is called patent ductus arteriosus. So left pulmonary artery, blood flow from patent ductus arteriosus. Third is the fetal circulation. Now fetal circulation carries the umbilical vein, transports blood rich in the oxygen and nutrients from the placenta to the fetus body. Then the umbilical vein enters the body through the umbilical ring and travel along with the abdomen wall to the liver. About the half of the blood carries passes into the liver, where it gives off a branch to the liver and later joins to the inferior vena cava via the hepatic vein. The other half of the blood bypasses the liver through a shunt called ductus venosus. Blood then travels to the heart through the inferior vena cava and mixes with the deoxygenated blood returning from superior vena cava and empties into the right atrium of heart. After that, fetal lungs are not functioning. Most of the blood bypass the right ventricle and be shunted to the left atrium via foramen ovale. Some blood will enter from the right atrium to the right ventricle and proceed into the pulmonary trunk. However, most of the blood will be shunted from the pulmonary trunk and into the aorta via ductus arteriosus. A little blood travels to the lungs in the pulmonary artery from their development. The rest of the blood travel down descending aorta, mixing the deoxygenated blood from the right ventricle. The rest of the blood passes into the umbilical arteries, which branches from internal iliac arteries and also called as descending aorta and lead to the placenta. The placenta deoxygenated blood returning from the umbilical arteries and repeat the fetal cardiovascular cycle. So here you can see the ductus arteriosus, foramen ovale, ductus venosus. The blood flow from the liver. Some blood will be in the liver, then it goes to right atrium to other ductus arteriosus. Some blood go in the left atrium and ventricles. The changes are the blood. What are the changes? Foramen ovale will be foramen ovalis. Ductus arteriosus will be ligamentous arteriosum, and ductus venosum will be ligamentous venosum. Umbilical arteries will be umbilical ligaments. Umbilical veins will be ligamentum teres. So here we will see the summary. Throughout the blood vessels, fetus receives the nutrient, oxygen, life support from the mother through the placenta, and waste products and carbon dioxide from the fetus are sent back through the umbilical cord and placenta. So these are some bibliography, and I would like to thank for this session. Next topic we will see in the next session. Thank you for listening Swati.E.Learning channel.